Hi everyone. I'm a bit worried I'm going to get this microphone and start breaking out into karaoke, but let's see how I go. So this is me, Susan Sinclair. Thank you very much for inviting me. And this is me having my flu vaccination. And this is the logo that went out on the front of our weekly newsletter every week. For those of you, For those of you that don't know 80 Medics, we run about 37 sites across London in primary care. We have over 230,000 patients registered with our sites, and that means that we have 50,000 patients now eligible for the flu vaccination every year. And I guess we've heard a lot about the system perspective, but the key thing for us is that this is a vaccine-preventable illness that is causing significant mortality and morbidity. But importantly for us is also driving an awful lot of GP and hospital attendances. We also know that from a primary care perspective, flu is really hard work. It's a time-limited season with very high volumes. On average in our practices, it's about 21% of our whole registered list is eligible for the flu vaccination, and it's incredibly resource intensive. You know as well as I do that this is an absolute miracle of organisation around recalling, coordinating supplies, and making sure that you've got the right clinical capacity for 16 solid weeks. And it's a time of year when GPs are generally cranking up for all of the other targets that they're trying to meet, so it's very operationally challenging. And in 15-16, which was the year that I first started at 80 Medics, we had, as you can see, pretty average flu performance. At best, we were average. Like most London practices, we were quite focused on the over 65s and were better, but really not great on the other cohorts. And that little orange dot that those of you that aren't at the very back can see is how low our lowest practice was. So you can see the variance was really, really high, and we had some pretty appalling uptake. And when we looked at what was causing that, we realised that we didn't have very much real-time information. So during the flu season, we were getting information from the practice teams every month, and they would say, don't worry, it's fine, Susan, it's just the data's a bit out of date, and next month it's going to be fine. And you know as well as I do that once that's happened 3 times in the flu season, it's over. You've missed the chance. Our cohorts, we didn't really understand in a fundamental way. For us, 49% of our eligible population is under 65, that's the working age cohort, and there are different dynamics in terms of the recalls and so on that affects those cohorts. Also, we sort of gave everyone the 75% targets for everyone and said, good luck getting the flu, we'll see you in January. And those numbers are just too high to work without a weekly plan. It's totally overwhelming, particularly if you're a practice that's really only ever got 10 or 20%. You're not even going to try to get to 75% because it's not realistic. And the data visibility was low. So we are avid readers of the PHE weekly newsletter, but what we were finding within our organisation was that we weren't sharing and comparing that data. And I know some of the CCGs here are great about showing that, and that's something we love to compare ourselves to. But across the organisation, no one really had a good grip on who was doing well at flu. So within 80 Medics, we developed a dashboard that enabled us to plan the amount of work that was required on a weekly basis, so breaking it down much more, monitor uptake on a weekly basis so that we could spot variance, and also share data so that we were really socialising the flu season. And what that intense data understanding gave us was a bit of a fundamental understanding about some of the things that were missing from our flu planning. First of all, we simply didn't have enough capacity. If you're trying to immunise something around 50,000 patients or aspiring to, we needed more people. Otherwise, we could not give a healthcare assistant or nurse a single day off in the whole flu season, and that's completely unrealistic. We also realised that we needed to give people the right targets and trajectories so that at a practice level, they knew I have to do 10 children this week, 20 over 65s and 30 under 65s, much more easy to cope with. And I always say this is a bit like giving people sat nav. You can't expect them to get somewhere without it.